All right, thank you very much, Steve. Well, new at 6, the state of Vermont now joins a small list of states that allow doctor-assisted suicide. The Patient Choice Act passed yesterday. It allows physicians to prescribe a lethal dose of medication to terminally ill, mentally competent patients who want to end their lives. The new law says a sick patient over the age of 18 must formally make the request at least 3 times, once in writing to his or her primary doctor. There is a 15-day waiting period during which time that doctor and a consulting physician must agree with a terminal diagnosis and that the patient has less than 6 months to live. Now, if those requirements are met, the prescription will be filled. Jennifer Lukey joins us now live in the newsroom. Jen, I know you were in Vermont today. This is certainly controversial. So what are folks there saying about the new law?
It is controversial. Most of the people I spoke with today, Greg, say it wouldn't be a choice that they would make for themselves, but they believe that anyone who is terminal should have a choice to end their life.
If I was in a lot of pain and life wasn't going to be worth living and I'm a burden to somebody, I really feel that if people can have a choice, they should be able to.
In my personal opinion, I'm okay with that. I think it's a personal decision. Myself, I don't think I choose that path. I'm religious, and but as far as your opinion, it should be up to you.
Opponents of the law say it's a slippery slope. They worry it could be abused or terminally ill patients could be pressured into taking the medication.
When you look at the hard data, most of the fears that opponents to physician-assisted suicide had do not crystallize at all. So there's no evidence of abuse or coercion or a slippery slope towards active euthanasia.
Dr. Giza Lopez has been studying doctor-assisted suicide for years and says even in the 3 states that already allow it, it is rarely used.
Very few people use it. Of the people who ask for a lethal prescription, not all of them actually take the medication. So many of them do request the medication for issues of control. They just want to know that they have a backup plan.
Last year in the state of Oregon, 114 patients had the prescription filled. Just 63 actually took it.
A very small number of people, and we know a lot about them. We know demographics about them, we know their age, we know their underlying illnesses. So, for example, people with cancer tend to choose this disproportionately if compared to other terminal illnesses.
It's a choice, she says, that doctors need to agree to as well. They are not mandated to assist. They can if they choose and if they feel it is in the best interest of their patient.
I'm 83, and if I were in dire need of having my life shortened, I wouldn't hesitate.
The Vermont Department of Health will prepare guidelines for doctors over the next 30 days. Under the law, physicians are granted immunity from prosecution if they follow those requirements. Live in the newsroom tonight, Jennifer Lukey, CBS 6.